coronavirus. Did you send something?
I think I did. I think did I send you the herbal formulas?
Yes.
Yeah.
Yeah. So what exactly is that?
Well, you know, I haven't tested it out, of course, because I haven't treated any patients with it. But those came from 2 different hospitals in China, and it was their publication of how they're approaching the problem from an herbal perspective.
Yeah.
And it's interesting because, you know, they talk about the 2% death rate, but China is, for the most part, where the resources are available, treating it with herbs in addition to antivirals, which is not what's happening in Iran and Italy and all of that. So it'll be interesting to see if the fatality rate changes or that sort of thing. I've read a couple of articles in other publications, one in JAMA and one in Lancet. And JAMA mentioned, well, they didn't actually talk about it, but you could read between the lines based on the labs that they're seeing a lot of fibrinogen being produced. So I guess that's part of what is creating the I guess that's the distinction between people who are dying and people who are not dying is the fibrinogen levels according to that paper. And then in Lancet they talked about something called a cytokine storm, and they tested cytokines I'd never even heard of, but I guess it's such a surge of inflammation that's what's creating the multiple organ failure and such. So these were both very interesting articles. I'll see if I can find. I'm pretty sure I can find the links for them again and send them to you if you like to read on that. You know, from a more deeply medical perspective.
Yeah.
You know, I don't know how to be prepared for it, but I've tried to order as many antiviral herbs as I can because I think also the supply out of China is going to run out.
Yeah.
And in fact, I've today I'm going to put out an email to all my patients and say, you know, please plan on anything that's important to you. Please plan on purchasing a 3-month supply from me because I don't know that I'll be able to provide the things that I usually provide. So. Yeah, it's just all very unknown.
Yeah.
Yes, I have a nephew actually in Shanghai, but he had left when that left because of the Chinese New Year. They had left to go to the Maldives on holiday.
Mm-hmm.
Around that time, so I think they left just like in a good time.
Wow,
and then,
good for them.
Then they couldn't get back actually, so they're home in Ireland now. It's my nephew and his girlfriend. They're both Irish, but they're teaching, and college wants them back for the 2nd of March. But I think they're going to have to do 2 weeks in a quarantine before they're allowed back in the college, from what I gather.
Wow.
Wait, they are going to have to go through quarantine going into China.
Yeah.
Oh, that's a cute one. I guess we're now going to have to be quarantined no matter where we go. So better not to go anywhere.
Well, and that's how I opened the conversation. You missed that part, Mary Jo, but how we started this was I'm having a lot of reservations about traveling back and forth to Houston.
Yes.
So,
yeah, probably at this point in time, I think nearly avoid any, as I say, unnecessary travel.
Yeah, although California already has cases and right in our own county, so so in some ways I don't know if I'm really safer there. I can pick it up just going to the market.
Yeah.
Anyway, I don't want to take any more of our time on that subject. So yeah. So do you have any questions, Mary Jo? You're always good with starting us off on a topic.
I had one for you actually, Camille, just on something we had been discussing, the PMS.
Oh, yes.
The progesterone that you, I think you sent me a link to, the substance the progesterone
Absolutely.
you were using.
Absolutely.
So Dr. John,
Works like magic.
yeah, Dr. John Lee, right?
Well, that's where I buy the cream, and that's the person whose book first alerted me to it. I don't know what products are available in Ireland, but I think his books are very well written and clear.
Yeah, well, I did. There is a European site, but when I went in with it, I didn't have time to spend too long on it. But it was firstly came up in French, and I didn't appear to be able to find the English to change to the English language. But anyway, I think it's available. So my intention really is to purchase some, because I just have a particular patient that suffers
Oh, nice.
from PMS.
Mm-hmm.
So I just wanted to maybe clarify the prescription itself, do you know, as regards when the people, they should take it.
Yes. How old is the patient?
Should approximately 40.
Okay. So by the age of 40, she's already in perimenopause. So
Yeah.
she's going to probably need a larger amount, maybe even exceeding what they recommend. Now you are ordering the specific product that I mentioned, progesterone.
Yes.
Okay. So what you'll notice is on the back of the tube, there's a little dot on the back, and that. So the cream, you're supposed to take a dot that size, and that's considered a single dose. Now normally they recommend 2 of those dots a day. However, at 40, she's going to need probably a lot more. So what I would say is, generally speaking, I would start her probably at ovulation on 2 dots a day. And then she should carry the cream with her. When the PMS kicks in, then she can start with 2 dots in the morning. But if that doesn't help, she wants to go up and take a 3rd dot, and then see how she is. If she feels a bit better, but not all the way, she can even do a 4th. Probably not 4, but I would recommend 3. And then she needs to titrate up all the way until her menses comes, based on how she feels. And you want her to keep a little log each day saying, oh, I had these symptoms, I had 2 dots, it wasn't enough, or maybe I felt a little better. But that log that she keeps will then be her guide for the future, so that she doesn't have to do the titrating up, because she'll just know, on day 23, 2 dots was plenty, but on day 24, oh, watch out, I needed 4, Yeah. So she'll create her own curve, and it's very individual. And it can even vary based on alternating months, like one ovary versus the other. Could be at that age, maybe, one ovary works a little better than the other. It can also vary if, this is more of an issue here than I think in the EU, but, here we have a lot of food that, like the cows are fed hormones so that they produce milk all year long. And then when we eat that food, it throws us off hormonally. But even so, there are a lot of ambient chemicals in the environment. So depending on diet and exposure, it can vary a little, but basically she'll create her own curve. And then in future, she'll just know, like, on this day, I use this many dots. Now, it's always going to go up as you, or it'll stay steady or go up as you approach menses. It'll never go down. If she goes down, she's going to trigger like PMS, like she's fallen off a cliff. So you always stay steady or go up. And then when you get to the beginning of the new cycle, and it's not necessarily when the bleeding first starts, it could be even day 2, but what you'll get is you'll get this sort of like, oh, okay, I feel normal again. I got through the cycle. The PMS is okay. And that's when it's time to drop. At her age, I wouldn't drop to 0. I would drop to half of whatever the peak was. So if her peak was 4, drop it to 2, and then stay at 2 until ovulation. And then she can pick up the curve that she's created from there.
Okay, so it's a continuous treatment then, really, every day?
Well, it is until menses stops. And then when menses stop, the brain will continue to cycle for a while. So she may keep the same regimen, but if it's a postmenopausal woman, then what I do is I just keep them on the same level every day of the month. So eventually she will, she'll settle on, 2 dots a day for the whole month, or 3 dots a day for the whole month. And that is mostly just banking up the reservoir, which will keep her more youthful, helps muscle tone, helps sex drive, helps mood, helps energy, just lots of things. It just gives you youthfulness after that, but you don't want to be cycling. You don't need to be cycling.
Okay. And how long roughly would one tube, like what would you think would be, just for a trial purpose, just would I need to get like 6 tubes or 1 tube, or how?
Oh, for one patient?
For one patient at the moment, anyway.
I would, well, I guess it depends on how much shipping is and how difficult it is to get. I would get 3.
Okay.
And then you would consider getting some for you, because it's just lovely.
Yes, that might be an idea.
It's just lovely.
Okay.
I mean,
I
don't know. I feel like it's a privilege to have it available.
Yeah.
I also think it's a fabulous face cream. I mean, whenever I start getting a little jowly, I just, I use it on my face.
Really, yeah.
And it's fabulous.
Yeah. Sounds like a wonder cream, all right.
Well, I mean, in a sense, it is. It's youthfulness. So from a Chinese standpoint, it invigorates liver qi and mildly tonifies yang.
Yeah.
So that's what you're looking for. Is essentially, it's an antidote. It's the best antidote for liver qi stagnation as it is relevant to gynecology. So it's going to help depression. It's going to, it helps that emotional fragility that you feel with PMS. It just helps your energy. Yeah, it feels lovely.
Okay. I'll definitely give it a try and see.
Yeah.
This particular patient, she is very vigilant, actually, coming for acupuncture, even though she had a little spell recently that she didn't come, but she finds the acupuncture good, but her symptoms are fairly severe,
Yeah. Well, and also it's oxygenating and it's anti-cancer. So, there are a lot of really good reasons for taking it, besides my cheeks getting jowly. Yeah. So is that okay. Oh, the other thing. Okay. So low progesterone is PMS. The right amount on a daily basis is just, as I said, good mood, good energy, feeling youthful, feeling agile, feeling good muscle tone and all of that. Too much is going to be liver fire.
Yeah.
So I literally, I had, I tell patients this all the time, that more is not better. But I had one patient who who liked how she felt so much, she kept doing more and more and more. And at one point got so angry that she put her fist through a door.
Mm.
So I told her at that point that it was probably too much and she should scale back. But that's an American mentality.
Yes, if
I'm fairly certain your patient won't do that, but I, you know,
yeah,
I have had some excessive patients over the years.
yeah. With benefits like that, it's probably tempting to up the dose a little.
Yeah, exactly.
Yeah.
So similarly, I have a patient who's an MD, a man, and I recommended magnesium for sleep, and he liked it so much. And I told him all of the things to look for that were too much magnesium. And he ignored them all because he loved how he was sleeping, and he kept taking more and more. And he took so much that his magnesium overrode his calcium function, and his heart could no longer contract. And he ended up with a $10,000 workup at Stanford for his heart. And it turned out he was just taking too much magnesium.
Mm.
And then I said, didn't I tell you all the symptoms? And he said, yes, but I was sleeping so well. It's like, you're an MD.
No.
Anyway.
How is so I believe magnesium is better absorbed through the skin. Is that right? It's rather than taking magnesium orally.
That's not been my experience. I find minerals to be very available. That's not been my experience, but
yeah, that's what I had heard, that it was actually better to like get magnesium flakes and dissolve and spray it on the skin rather than.
Well, I think Epsom salt baths are nice and they work well, but I don't know that they're more absorbable. I find them less absorbable. And also magnesium sprays tend to be a little, sometimes like you can actually feel the minerals on the skin, like they feel almost sharp, like little, they feel sharp, like little knives. I find I don't particularly care for topical magnesium all that much, but maybe I haven't found a good brand. Anyway, I don't want to take all of Avi's time. This is Avi's show.
Oh. It's all right. No problem.
Is it all right? Okay, I'm sorry. So
no problem.
Anyway, does that
Yes,
you have a good sense of it? Okay.
Yeah.
Feel free to email me too. And
Yeah.
I always tell the patient to, when they're the first month or two, to please be in close communication with me, because sometimes they can't tell the difference, for example, between liver qi stagnation, irritability, and liver fire, anger.
Yeah.
So you have to watch that sort of thing closely. Oh, and one other thing also that's very important is that the not necessarily, it could be the first month or maybe even more so the second month after she starts, she's going to flush out a lot of clots. And so she might have very extreme cramping, and you want to warn her of that. If you warn her in advance, then she'll be fine with it and recognize it's normal. But it's actually very good because it's flushing out all the old blood, and then she'll have much less cramping after that.
Okay. Great. Yeah.
And when they have cramping, I have them rub the cream right where it's painful.
Okay.
I think that's everything.
Great. Thank you, Camille. That was great.
Absolutely.
Yes.
All right. Anything else?
Do
you have anything, Camille?
Well, I always say no, and then once you get me started, Mary Jo, then I have a million questions after that. So please go ahead.
Well, I don't have anything too urgent or anything, but that actually that particular patient, Abby, also has like in abdominal, when I did the abdominal analysis, palpation just on the left under rib. I know it's an area you say that doesn't usually show that it's
unusual,
sort of African kind of, different infections that you get mostly in Africa, is it? But it's kind of from, say, like roughly halfway down on the left side from center and down to the base of the ribs, let's say. And it's very tender there. Now, spleen 5 and 9 seem to, it seems to get better once a needle. But it keeps coming back, every time she comes, it's like really, she nearly kind of jumps when I palpate in that particular spot.
So the pain is basically just under the rib.
Well, it's kind of from, we'll say maybe like nipple line.
Yeah.
To the side, to the side. So kind of just from that area.
Wait, from the nipple line to the sides, but is it under the rib? In other words, it's basically under the diaphragm, or is it on the rib?
Yeah, under the diaphragm, but along that line, let's say from.
So a little further out. Okay, so a little further out from the nipple line, but under the rib. So you have a few. Now, anything in her medical history besides the PMS?
Well, she did have glandular fever, which I was suspecting maybe.
Okay, so it's basically the glandular fever that's causing it. Basically. So because glandular fever is what you guys call glandular fever is the same as Epstein-Barr, right? Does anybody? I believe glandular fever is what in America they call Epstein-Barr, like quote unquote kissing disease, right?
Yeah.
Okay, yeah. So that's another thing. That's another one that attacks the spleen. So generally speaking, most things that attack the spleen are more tropical, like dengue, malaria, things like that. But glandular fever does attack the spleen. So chances are.
I'm sorry, can I interrupt? Because I don't know what you mean by glandular fever.
Epstein-Barr.
Oh, okay. I'm sorry, I missed that. Okay,
yeah.
Okay,
no.
Thank you. Okay, go ahead, proceed then.
The British have the British call what here they call Epstein-Barr. In England, or I guess in Ireland also, it's called glandular fever.
Okay, thank you.
And which makes sense because it attacks the spleen and lymph nodes. It's a gland, so the name kind of makes sense.
Even though it was along, like it was the early 20s.
Well, yes, but the thing is, it's already attacked the spleen. There is something in the spleen that could be, I don't know if there's scar tissue, but yeah, I understand that it isn't current. So what I would do, so yes, spleen 5, spleen 9 would be helpful. The other point that would be helpful, go on the left side, go to do 20, go to the side, look for a bump under, sort of maybe gallbladder area, on level with do 20, look for, not a bump, a dent. That should help release it. And also immune points.
Yes, I always do the immune point because she has actually type 1 diabetes as well.
Oh, wait. Type 1 diabetes, meaning since a child.
Yeah, well, actually, I don't think, I think she said it was just diagnosed in her early 20s as well.
Oh, okay. But she's not receiving, so she's insulin dependent.
Yes, yeah.
Okay. Okay, so
I do the diabetes treatment always on her. I do the spleen 3 adrenal
and immune. Okay.
Immune points,
so the problem is if you're doing spleen 3 and then you're adding spleen 5 and 9 on top of it, that could be a little bit too much.
Yes, well, I kind of did it in
two separate issues. Okay, no, that's fine. So if you do spleen 3, take the needle out, then do spleen 5 and 9, that's fine. Because otherwise there's just too many confusing messages possibly on this poor spleen channel. the other thing in your adrenal, because she has this strong PMS. So now this is interesting. So her PMS, what are her PMS symptoms?
Just really low mood, depressed. She said she often has crying spells.
Okay. So more emotional.
Emotional, yeah.
Okay, as opposed to cramping.
Yes, more emotional.
Some women say PMS and they literally mean cramps.
No, she'd be more emotional.
Okay. Because so the cramps the cramps would have belonged to spleen 3 category, by dogma. The mood will belong in spleen 3 pericardium category. Okay, so see if adding something like check pericardium 8 and work accordingly, and especially on the left side is important. The other thing that can be important is Sun Jiao. So Sun Jiao relates to autonomic nervous system because, a number of reasons. First of all, the Sun Jiao controls the SCM, meaning controls the vagus nerve. The other thing is the Kerta Jiao, is burner, but when you analyze the character, it's a bird. It's like making putting a bird on a fire, roasting a bird. That's why it means a burner. Okay, so a burner burns something. In this case, it's a bird. Now, if I were the bird being burned, I would feel a little anxious too. So the Jiao also means anxious. So the Sun Jiao has a relationship to anxiety, moods, things like that. So in terms, and of course it has a relationship to lymph. So in terms of lymph, you'll get the most for your buck probably from Sun Jiao 1 and 2, supposedly. However, because in this case, it's quite possible that the anxious, the glandular fever happened, so many years ago, 15 or more years ago, then probably more important is the anxiety. I would go for either Sun Jiao 5 or Sun Jiao 8.
I normally do those, actually have it because she
regardless.
Does SCM
yeah.
tightness generally, so I really always do them as well.
Okay, so cool. So now, okay, so next question is, what is her blood pressure?
I'm not too sure if she ever, I don't think she has a problem,
People often don't say they have a problem, but the gap, first of all, if they have low blood pressure, they'll say no problem, and they don't even know. And the other thing is they have a weird gap. So my suggestion is ask her, I'm assuming that you guys, that it's easy to get blood pressure done, like often pharmacists will have it, the pharmacy stores will have it. It might be worth checking the blood pressure and seeing, because what you're saying basically is you're basically addressing everything theoretically that we're coming up with. I have one more to suggest, but that's, we'll look at that in a second. When that happens, then the question is why aren't things stabilizing? The answer is usually because something is being left untapped. Something's not being addressed. So that often, one of those things that can often be the case is blood pressure, and often low. Or say they have a blood pressure that's 120/60. That's not considered low, it's not considered high, it's not considered anything, but the gap is weird. Or 100/80. I mean, when the gap isn't right, things in the body are not working well, and that suggests to you to use under the third toe. And at that point, what I would do, if it's like really clear, I would, instead of the spleen 3 or the spleen 5 and 9, I would just go with spleen 6 and 9 and see what that does. Instead, which is the blood pressure combination. So you have ways to play with options. Now, in terms of adrenal, because she has PMS, the kidney point that tends to resonate with PMS best is kidney 7 rather than kidney 6.
The one I do actually, because she does show adrenal on the left side actually.
Sorry, she what?
I do 7 normally because she does show has the adrenal reflex as well.
Well, adrenal reflux if you're talking about adrenal reflux in the abdomen as in below kidney 16, that doesn't dictate kidney 7. What would officially dictate kidney 7 in terms of palpation would be kidney 2 pressure pain. Okay,
Right.
so
Yeah.
So it sounds like you're doing, so it sounds like there's a component in this person that's still missing, meaning there's a part of them that's not being addressed, which means that even though you're addressing everything else that you're seeing, that other thing is, as that we haven't discovered what it is, let's say, is just not letting the body heal. Now, you're doing a back treatment as well. I'm just checking.
Yeah.
Okay. So
I do UB66 generally.
UB66, okay.
I do that generally.
Makes sense, hormonal. And
I think the reason I was choosing 7 is because of the PMS, because like it's part of the diabetes treatment anyway.
Yeah, but it could be kidney 6, for example. So that's why, I'm just saying that when you're choosing your adrenal, I would tend to give preference to kidney 7 as opposed to kidney 6. But the question here right now is, what is it that we're not seeing on her? So let's go through her. What is her medical history? So she had glandular fever. We know she has PMS. What else is in her medical history?
There isn't much else actually. Just the diabetes. When she was diagnosed with type 1, and the glandular fever and the PMS, there were main things.
Okay. Family history?
There wasn't a whole lot. Just Michael, she actually just came the other day, and I might be able to quickly locate her.
The bureaucracy of running patients.
Yeah, okay, so I have it to hand actually. So severe PMS, what she
wrote.
What she wrote initially was severe PMS emotional symptoms, not physical. Extremely low mood, 2 weeks to 10 days before period, crying spells, stress levels high, would describe it as a depression, a sense of being out of control. She had just a childhood, there was just like a hip, she was in a brace just because of a hip problem. And glandular fever, type 1 diabetes, acid reflux actually was another.
Okay, that still fits in a spleen pericardium category.
Yeah, and the PMS, basically, that's all.
Okay.
And sorry, family history asked me. Her brother had type 1 diabetes.
Okay.
Granny. No, I don't think there was anything significant in yeah.
Okay, so from this, relatively little bit. Okay, so a few other things to look into. So there is a chance, it sounds like she has always been susceptible to emotional issues, because you said there was something in childhood. It sounds like even prior to PMS, that there was something emotional going on. I can't remember exactly what you said.
No, this was just what she had put down on her presenting complaint, was stress levels high.
Okay. There was something. Anyway,
PMS treated since 2007 with Prozac. And then she came off that.
Okay. So what you're saying, so that's the medical history. Next thing is, what did you find in the abdomen and the neck? In the back?
She usually has both sides SCM. She had left side adrenal.
Only left side?
Yeah, only left side.
Okay, so that doesn't, usually that would not qualify as adrenal, and because she has diabetes, that would probably qualify as reflecting the diabetes. Insulin dependent will tend to show a lot, almost like a lump on the left side around the navel. So she may actually not be adrenal. We don't know. No, because sometimes it's possible that it only shows one side, that the other side hasn't picked up. But generally, if you think about it, usually the adrenals work together both sides. But it's possible that the connective tissue doesn't show. So I can't say for sure not adrenal. But it doesn't matter because adrenal is still part, whether it's show or not. It shows for diabetes, so it's not, doesn't change the treatment. And she has under the left ribs.
She's under the left ribs, towards the side.
Yeah, and
a little bit towards the center. Like I wasn't sure that it was liver. Like it's more closer to the rim line.
Okay.
On the right, on
so
the
chances
right
are,
side.
yeah. So what I'm thinking is there's a possibility that what she actually has is a tight diaphragm. You know, now that might be complicated with the spleen issue on the left side, but actually what she has is a tight diaphragm. So you want to release that. So that still comes under spleen pericardium, but what I would do is, since there is a hormonal component anyway, check bladder 2 and check small intestine 13, Sanjiao 15 area. Those are 2 hormonal areas. Now, so 2 things. Release bladder 2. Okay, you can release bladder 2 with small intestine 3. You can release bladder 2 possibly with inner yin, which is another hormonal area. You can, so do what you can to release bladder 2 and then needle bladder 2. Okay, and you can also check the effectiveness of bladder 2 against, say, Sanjiao 15, small intestine 13 area, which is another hormonal area. But you really want to release, it sounds like releasing the diaphragm is one of your big, could be a big component here that's still missing. Okay, because everything else you're doing, you know, if you're doing spleen and pericardium and Sanjiao, you're pretty much addressing theoretically everything that she is revolving around. You know, the anxiety, the stress, the acid reflux. You know, you're basically, you're sort of covered. So there's just something else that hasn't opened up.
She does have right side stomach 26, 27 as well.
Okay. And does kidney 7 take care of it?
Yes.
Okay. So what I would do is, and does immune take care of it also? In other words, check each one separately. So check the different possibilities for stomach 26, 27. Just to make sure that maybe it suggests some, well, we know she has a digestive issue, but not an intestinal digestive issue. So it's probably not, it's not likely to be reflecting her acid reflux, but is it possible that there is some other digestive issue that she just doesn't think about and she doesn't say? So I would start thinking and looking at, so pick up the what you kind of need to do is pick up the medical history and analyze it, and pick up the palpatory findings and analyze them. See if you can correlate them or not. And then address each one. See how much mileage you can get by breaking down each one of those components of the medical history and the findings. So that what happens is often people say, oh, I release this reflex, therefore I'm done. And unfortunately, that's often not the case, especially when a patient keeps coming back with the same complaint and it's not getting better. You're not getting the mileage you wanted. It suggests that there's another way to release that reflex, that we chose a way that was kind of like, that was the obvious, or that was the convenient, or whatever, and it's releasing the reflex, but it's not getting to the root of the problem. So take each reflex and see if you can release it through other methods. In other words, you already know what you can do and you should do, but are there other methods? And that will give you, hopefully it will start sending you towards the so-called missing link here. Okay, so one of the things I would check, you know, with something like that from what you're expressing is, how much does bladder 2 do alone against everything? It doesn't mean I needle it right away. It just means I'm just checking. I want to know bladder 2, how much better is the abdomen, the neck, blah, 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 blah. How much does UV66 do on its own? How much does small intestine 3 do on its own? By checking that, you're kind of getting into a picture of what kind might be primary. The problem with a point like kidney 7 is kidney 7 tends to like knock out lots of things. Okay, so on the one hand, yeah, great. The problem is when you get a patient like this one, where it's not so, where it appears like there's something missing. If you're using kidney 7 up front, you miss the opportunity to check all your other things. So you don't have a lot of, you're not left with a lot of options. Now, does she have slow pulse, rapid pulse? What kind of pulse?
It's not rapid.
It's not rapid, okay, but it's not slow.
It's not slow. No, it's kind of like normal.
So normal, okay. Anything about the quality that you think that attracts you, or nothing special?
No, nothing special. She does have gallbladder 26 on the left only as well, and a little bit on the inguinal.
Okay, well, okay. So now we're getting into something, a whole new possibility. No, seriously, because you said there was some hip problem as a child. She was in some sort of, you know, but you didn't mention what it was, and maybe she didn't mention what it was.
She just said she was in a brace.
Okay.
Age, you know, just born obviously in a brace due to a hip problem.
Okay, so just, you know, when someone tells me these things, I don't let those things slide, kind of thing. I don't buy anything that they say. I want to know what it is if I can possibly find out, because you don't, you know, like what happens if you find out that actually she had some sort of bacterial infection? I'm making shit up, right? But suddenly it starts matching up to her glandular fever, you know, or not. And by the way, we don't know which hip it is, but let's just suspect that it might have been the left hip, because, I mean, I don't know, because she has left gallbladder 26, but that could have come from the other side as well. I would start looking at what the hell happened in this hip, because with this is the base here. Her original injury is very clearly the diabetes. It's not her original because she actually had the hip before, but it's the deepest part. It's one of the deepest things that can happen. Diabetes affects every cell in the body. Okay, and she has a brother that had it. So either something happened to them, you know, like you can say, oh yeah, mama was a big smoker when we were, because the mother doesn't have type 1 diabetes, and neither does father, according to what she wrote, which she may have forgotten. But she doesn't mention that anyone else in the family except brother. So either it's a genetic component or a weird environmental component as children, which would be a little bit weird, but it's possible. I don't want to take it out. Or in utero. Okay, so hereditary, maybe it comes from a grandparent, and the parents didn't have it, but there's something with that. These are things. So that's something to consider. But the other thing that in terms of her life, the first injury that we're aware of is the hip. So what the hell happened with this hip, and can this hip be a way to address everything else? So now the question is, you know, ask her, you know, what did happen in the hip, palpate the hip, see what there is around this hip. And because it would appear that she still shows, she shows the inguinal, she shows gallbladder 26, both on the same side. So chances are it's some sort of hip issue that's going on. And Mr. Toro, it's okay. And he's upset because he was munching on my arm, and I was like taking it away. So all I'm saying is that start looking for other, you know, you've done all the so-called obvious, you know, and that hasn't worked as well as you wanted. So now you have to push yourself into looking at the less obvious. So one of them is look at the other hormonal component, and the reason why bladder 2 specifically is because it also affects the diaphragm. Okay, so it's both a hormonal reflex and it opens up the diaphragm. Okay. And then blood pressure is often one of those components that are missing in people. It could be thyroid, but you're already addressing thyroid by using kidney 7. So that's another one that I'm looking for. Okay, do you have a thyroid issue, especially since she has tight SCM? And the other component that, that's very typical is some sort of autoimmune. But we don't, she's not suggesting she has an autoimmune. However, the hip thing might have been an autoimmune disorder. So there's nothing else now, but there might have been, in which case you're basically doing everything. The only thing you're not doing is lung, because you're doing already kidney 7. So all you would add for autoimmune would be lung. And then REN4, which you may or may not feel comfortable with doing during PMS, or, well, it's only emotional, so that's totally fine. So there's no physical. And the last thing is hereditary, to address the fact that how come you and your brother both have type 2 diabetes? It suggests something, pre-birth. So then you have a number of options here. One of them is small intestine 11, which should have something to do with PMS, with the diabetes. But the name Tianzong, the heavenly ancestor. Okay, so supposedly when the ancestors are looking down at you, they're not going to look at your front because you come past them. So they're looking at they're sending their energy into your heart. So that will be through that dimple at small intestine 11. I think that's why they named that point that way. But it's a point that's highly correlated with digestion. So can have something to do with diabetes. The other point is UB43, Ga Huang. By name Huang means something in the body that's missing, that's been buried. So those are the ancestors already buried. And the other Huang, there's 3 other Huangs in the body. One of them is kidney 16. The other one is outside the Sanjiao Shu. And the last one is outside UB32, whatever, 50, whatever it's called. That's Bao Wang, the uterine Huang. And it's part of the sacroiliac ligaments. Okay. So that's very important for any sort of, she has some people will say that's not a gynecological complaint. I would argue that it is a gynecological complaint. PMS, if it's emotional only, is still gynecological in a way.
Yeah, normally do bladder 32 and the sacroiliac ligaments as well.
Sorry? You do
bladder 32.
32 you do.
And the sacroiliac ligaments.
Okay. So the things I would look to add would be maybe bladder, look at bladder, what the effect of bladder 43 and small intestine 11, and obviously you're doing T11, T12.
Yeah.
Okay. And does she show anything around T4, T5?
No, not generally. No.
Okay, I'm just asking. Because the other thing that's typical with gynecology, what people sometimes forget is, for example, how do you test bladder 32? Okay, so one option is against small intestine 13 for Sanjiao 15 area, which is hormonal. Another option is to test it against the heart shu area. Okay, because the heart and the uterus, the heart and the kidney, communicate, right, or supposed to. So one can affect the other. Obviously, UB32 would be more of your kidney point, and the heart 15, bladder 15 area would be more like a test of the bladder. So it's actually not uncommon for me to needle bladder 15 in order to release UB32. Some women, it's very painful around UB32. You can't needle it yet, okay, until you release it. So that's all I'm suggesting, is to try and find, what the hell is the missing link here, which you may or may not be able to do. Unfortunately, if we could always do it, or, that'd be very lovely, but we can't. And then the other thing on the back is do 2, do 15, and possibly bladder 35. So those are the only ideas that I have right now, given what you said.
Yeah, she has listed glandular fever at age 22 and diagnosed type 1 diabetes at 24.
And you know, the chances are, you know, you wonder, did the glandular fever sort of promote the diabetes? But at the same time, you also know that the diabetes was lurking because it's been lurking with her brother as well. So I mean, of course, they could be totally coincidental.
Yeah.
You know, but you know, the chances are that both of them have it for the same reason. That you know, so I would say the glandular fever is sort of it's not tangential, but in terms of the diabetes, maybe it made the diabetes come 2 years earlier or something. You know, a little bit earlier, but chances are, I mean, it doesn't make, if there was no brother with a diabetes and she has glandular fever and 2 years later she develops type 1 diabetes, I would say, oh, okay, maybe the glandular fever is really the big thing here, the most significant finding, because it triggered something that is unexplained by anything else. But we do have a possible explanation for the type 1 diabetes through the brother. In other words, we're suggesting that it's something in uterine or hereditary.
Mm-hmm.
You know, so we're not getting as big a hit on the glandular fever on the face of it. And that's where, you know, findings, the palpatory findings are really useful, because you kind of quote unquote test your ideas and say, by saying it's not enough that it releases, that my point releases, it's a question of how much does it release. If it releases just about everything, I've come to the conclusion that, okay, this is really, whatever the point represents, the idea that this point represents must be primary for this patient. But if it just releases what I wanted it to release, you know, like, oh, you know, kidney 7 releases gallbladder 26. Well, yeah, that's by dogma. It's supposed to do that. That's very lovely. So I would look at, you know, yeah, so in terms of REN4, because REN4 is the gate to what's primary, as in the head over the 2 feet. It has to do with the head, REN4, you know, and her PMS is, quote unquote, it sounds misogynistic, the PMS is in the head, sort of thing. So, you know, there you have a good reason to try and see if REN4 does something, and then you can say, well, gee, I wonder if there's something autoimmune, because type 1 diabetes can also be considered autoimmune disease, and we don't know what the hell this hip thing was.
And what would you test REN4 against?
Against everything you find.
Okay.
Absolutely everything you find. You know, so don't limit yourself to this idea that, you know, when you say, okay, it's a little bit like in the TCM world, you say, well, this is the pattern diagnosis, the pattern differentiation, based on the fact that you lack appetite and you're chubby and whatever, we're going to call you spleen dampness. And now the treatment is spleen 9 to resolve dampness. That's kind of like the TCM ideology, right? So we're doing pretty much the same thing. You know, it's like, it's not different, because every medical profession basically has to come up with some sort of etiology and treatment plan, you know, that corresponds to the ideology. So so what happens is people say, okay, here are your reflexes. And so we say, if you have these are the typical reflexes. So let's say something like acid reflux. Acid reflux will very likely show around REN15 or deep pressure on REN17. And we say the points to resolve that would be spleen 3 and pericardium. Okay, so very similar to the TCM. Now, so that's great. Now the question is, if I use, let's look at all the other reflexes this person has. And let's say, does spleen 3 and pericardium resolve all the other reflexes that this person has? And if it does, then you're saying, wow, acid reflux or spleen pericardium combination is the essential factor for this person. Whatever it is, I think it addresses, because unfortunately spleen pericardium addresses many things like anxiety, depression. You know, it's a big psychological component as well as acid reflux. If, on the other hand, spleen pericardium resolves the acid reflexes, but nothing else. But I find a point like, say, bladder 2 that resolves absolutely every reflex, including the acid reflexes. Then I'm saying, bladder 2 appears to be the big commander of this person's body. And then I have to make up a story. Of course, I had a story when I chose to test bladder 2, because I'm not a computer that I can test every single point in 3 seconds. Like if we had some sort of robot do it, it would be a lot easier. But it's, there's a reason you tested bladder 2. And then whatever story you had about bladder 2 that made you want to test bladder 2, if bladder 2 proves it, if bladder 2 just releases the diaphragm, which is it's supposed to, or it releases small intestine 13, which is it's supposed to, that makes it a treatment point like any other treatment point, a useful one for this patient. But if bladder 2 now resolves the hip, let's say, or the ankle, or the elbow, or the whatever, then that's what makes it the point. Okay, so just because it addresses the dogma was built around this pattern, shows these reflexes, gets cured by these points. When the point fits the dogma, you just, you quote unquote did your job, and that will work for at least 50% of patients, because dogmas usually work for about 50%. Okay, it's when a point goes beyond the dogma that you know that it's that it's essential. Okay. Now, then you add the dogma on top of it. So I'm not saying, let's just, for the sake of argument, say that bladder 2 resolved everything. It's not like you do bladder 2 and forget. No, you do everything you did because there was rationale for it. So even though the reflexes disappeared with bladder 2, you do everything you've done because there's good rationale for everything you've done. And then you add your great point, that the magical point, quote unquote. Okay, on top of it. So you're basically insuring yourself with the different strategies. Does that make sense?
Yes, it does, yeah.
So that's how I would approach it.
That's great, yeah. I need to ask a few more questions. I need to ask a few more questions.
Go ahead.
Yeah.
Oh,
no,
from her.
I mean, from her
Yes,
patient.
yes. Fair enough.
No, not today.
Yeah, no, I understand. I think the problem is we all have a tendency not to not pester the patient. We want to believe that what they write on paper should be enough, and it isn't always. I think, I really encourage people to kind of like, don't just take what they wrote on paper. Keep asking questions about it so you get better clarity. Sometimes you don't need to. Okay, so you can hedge your bets, but if after a few treatments you're going, I'm not getting the results I want, or rather the results they want, then I'm missing something, and that something is often in their medical history. And I also think that people don't pay enough reverence to the medical history. I mean, the TCM people basically don't ask about medical history because because the pattern differentiation has nothing to do with medical history. And the palpatory people often like to say, resolve the abdomen through the mechanics of it. But I think the medical history often gives you the biggest clues as to how most effectively deal with the patient and resolve the abdomen. So yeah, I mean, I would just go back, and that's every time I hit a case like this where, okay, I'm doing everything I'm supposed to. Well, why the hell aren't they getting better? The answer is always, I'm missing a link. And it might be a really crucial link, or it might be just crucial and it's really a sideline, but it's just gumming up the system. It's holding them up in whatever manner. And if I could only just release it, everything. And sometimes I'm successful, and of course sometimes I'm not, because there's nobody does 100%. So, so that would be my suggestion.
Yes, try some of those. Thank you.
All right. Anything else?
Sorry, Camille, I hugged the whole time today.
No, it was quite interesting. I enjoyed it tremendously. So, no, it went perfectly, Mary Jo. Thank you so kindly for presenting a lovely case.
Thank you. All right.
Thank you for your brilliance, as always, Avi.
Thank you. I will, my brilliance, whatever. So we will meet in bright times next week.
Super. Sounds lovely.
Bye.
Okay. Bye-bye, everyone.
Bye.
Thank you.